Hi, I just wanted to give you an update on why we're still open despite there being another national lockdown, and why it's the right thing for us to do to be open, what it means for you as far as like the risk level, the actual risk level of coming in to see us, and why we still think it's important that people come in to see us. I want to say a little bit about what we're doing to heighten our safety. We've right from day one, when we closed the clinic in March, we were prioritising our team and our patients' safety. That was why we made a decision to close the clinic in March and move everything to a virtual environment, which is still going, and we've still got lots of people on that, so that's still there as an option. I'll sort of discuss that later. We've not compromised on putting safety first all the way through, and I feel it's sort of important for me to explain why that means now that we're open during lockdown number 2 and hopefully the final episode of this series. So the main reason we closed in March was that there was too much uncertainty about how the virus was being transmitted and how it was being caught. Despite us being a healthcare setting, we were not at the elevated level of hygiene that we're at now. And also our insurers and our regulatory body wanted us to triage and only treat emergency patients. Everyone interpreted that differently. They didn't give clear guidelines as to what an emergency patient was, but I see an emergency patient as A&E. And whilst our phones were always open, we did have a few people that rang up, and I advised them to go to A&E. The vast majority we weren't open for, so we treated people on the virtual service, and that worked well, and that was what we felt we could offer. Now this time round, what's different is, from opening up, Public Health England have put very clear guidance in place as to what you have to do as a healthcare setting and how you have to triage every person. That's why we triage every person that comes into the clinic, regardless of how many times they come in. And you don't get in through the door if you've got any symptoms of COVID or you've got to isolate for any reason. That means that we can make sure that we don't see high risk, which is people with symptoms or isolating or a positive test. We only see medium and low risk. We can continue to do that, and then we have strict policies in place that means that we don't have a waiting area, so there's no person that you will come into contact with when you enter the clinic that is deemed high enough risk to be classed as a contact. So you will be met at the door, your osteopath will be dressed head to toe in PPE, you'll have a face covering on as you do when you go in any place. Then everything that's in the room will have been cleaned with hospital grade disinfectant. The air will have been cleared either by being sucked out by powerful air extraction or passed through a sophisticated air filtration that sort of removes the virus from any airborne sort of transmission route, which is definitely a credible transmission route, but it's not nearly as lightly a cause of transmission as face-to-face and sort of droplet spread or touching something and then touching itself. So that's taken out of the equation because everything in the room is clean for you to come into. Now, because we've got these standards, it means that we're not deemed at high enough risk to be classed as contacts. So if you come into the clinic and, for instance, you then test positive the day after, it doesn't mean I have to go home and isolate because of the PPE and because of the hygiene. If I test positive the day after, it doesn't mean you have to go down. If the person before you test, it doesn't have any implications for you, and so forth. So that's why it's absolutely safe for us to be open, because what the whole idea of a lockdown is, if I remember the messaging correctly from the first lockdown, it was stay at home, protect the NHS, save lives. So protecting the NHS, that's why lockdown is having to happen, because we can't cope. Now, anything that can take the burden off our National Health Service is helping that cause. That's what we do. People come to see us who might not be immediate, it might not be the very next day or next week, but if you don't treat things when they're at a treatable stage, when you can actually get involved with someone doing conservative methods, sort of hands-on treatment, structured exercise, then they get worse, and ultimately you might then be burdening your GP or a hospital or a walk-in centre, and that's fundamentally why we're going to remain open, because we're there to help unburden the NHS, and also we're a business, so we're here to provide a livelihood for our staff and provide a good service to our community. So if we were at risk, of transmitting it, we would change that, because we've always put safety first, but we're not. What I want to do, because safety is paramount, I want to see what we can do to increase our level of safety. So what we're doing is all the osteopaths, all the therapists who work in the building will be having a rapid COVID test every single week, and they're only allowed to start work that week on passing the test, essentially. Any symptoms, obviously, we'll go through the normal procedure of we won't come into work until we've had a clear test result. But having a weekly test means that because of the asymptomatic carriers, even though the PPE reduces the risk down to a negligible level according to Public Health England, I want to do more than that. So a positive test, even with no symptoms, would mean that person's not coming in and they're isolating for 10 days in line with governance until they've had a test through the test and trace network. That's the big change. We'll constantly review it. We'll keep our stringent triage in place. We may elevate it to sort of temperature scanning patients as they come in. As I say, the time that we leave between patients for the total clearance of air means that the actual risk of you breathing any of the air that the patient before you is about 1%. Everything's been cleaned, so the normal route of transmission is taken out of the equation. So aerosol transmission, 1% of an already quite sort of contentious sort of transmission method means that the real risk is extremely low. You can't remove the risk. The biggest risk probably for people to think about if they're sort of unsure about if they want to keep their appointment, which I totally understand, is more about how you're going to get to the clinic. Once you arrive at the clinic, you're absolutely fine. But if it's a case of taking public transport and you're already in a vulnerable group, then I would probably say we can certainly still help you, but the virtual service is going to be a better route to sort of help you. Virtual services, there's lots on our website. I don't need to sort of go through it here, but it is, we launched it in March. It's still going now, but I wouldn't have kept it going when we opened the clinic up and we were as busy as we've ever been if I didn't believe in it. It's a very good way of getting better. The long-term effects from what I've seen of it are better than coming in for an in-person appointment. It takes a little bit longer in the short term to get the pain level down, but the focus should always be on where you're going to be in 2 to 3 months rather than where you are in 2 to 3 days. Obviously, pain's a massive motivator for why you come into the clinic, and we want to get on top of that as quickly as possible, which hands-on is better at. But once you get through that first few days of sort of pain relief, yeah, there's no difference. So if you're worried about coming in, we've got a process of swapping you onto the virtual service, and it's accessible through any device, sort of mobile phone, computer, anything like that. It's very easy to use, so there's no sort of worry about that. But the real risk is very low of coming into the clinic, so don't be worried about that. It's more about how you're going to get to the clinic, and if you haven't taken public transport, then yeah, that would be a much higher risk. If you're driving to the door, coming in, or you're walking outside, obviously we know the transmission risk outside's much lower than it is inside. So food for thought. Don't live with pain. Don't sort of, yeah, obviously we need to do this as a national effort to sort of try and get on top of it with this second wave, but don't sort of undervalue the importance of looking after yourself. Obviously, the fitter you are, the better you are to sort of equipped to sort of deal with coronavirus if you ever caught it. And by coming to see us and possibly avoiding a trip to the GP or walking centre or anything like that, you are unburdening the NHS, so it is part of a national effort. So let us know if you have any questions. I'd love to know sort of what people think about this, and I'm more than happy to discuss it at any lengths with anyone, really. It's an important subject, and I just wanted to let everyone know where we are with it at the moment. Okay, we'll speak soon. Bye-bye.